Many new mothers worry about hair fall post-pregnancy. I see a lot of moms coming to me and saying, Doctor, I'm losing hair in bunches. My scalp is visible. Is this normal? What is going wrong and what can I do? Hi, this is Dr. Ravali, Yalamanchili, Chief Dermatologist, Naya Dermatology and Aesthetics. Today, let us understand why is it common to lose hair post-pregnancy, what are the precautions we can take and how can we treat this. During pregnancy, your body has high estrogen levels. This estrogen hormone helps to keep your hair under growing phase or anagen phase. Post-pregnancy, there is a sudden drop in this particular hormone, and due to the sudden shift of hormone, your hair enters shedding phase or telogen phase. This is the time where you tend to notice lots of hair fall, alarmingly high, which is usually normal. How does this postpartum telogen effluvium look? It usually looks like shedding of hair, usually in clumps, be it when you're combing or while you're showering. You might see strands of your hairs on pillows, and you also notice that your overall hair volume has come down. I know this is scary, but please understand that postpartum hair loss is temporary and usually this hair grows back. And some of the other factors that contribute to this postpartum hair loss is number one, stress. Physical and mental stress and exhaustion during pregnancy or even in the postpartum period can worsen this. Stress can also be because of your sleep deprivation, which is very common in new mothers. Some other factors include thyroid abnormalities, if you're not taking your iron supplements well, and if you're not taking a protein-rich food, all of these can contribute to increased hair fall. Postpartum hair loss usually starts around 3 to 4 months after pregnancy. That's when your hormones start dropping. This can extend anywhere between 3 to 6 months. But if your postpartum hair loss is continuing beyond 1 to 1.5 years, and if you're noticing that you're losing more than 200 or 250 strands of hair per day, please visit a qualified dermatologist for further evaluation. Some of the tips that will help you to recover from this postpartum hair loss faster, number one being well-balanced diet. Make sure you're taking diet rich in protein. At least 1 gram per kg body weight of protein is needed per day, and also a well-balanced meal which has fruits and vegetables, a lot of multi-nutrients in this meal. And number two is your sleep. Yes, we all know it is not easy when you have a new baby. Sleep is affected. Please try by managing your chores. Please go for role division and manage your sleep accordingly. So other simple tips is using milder shampoos and avoiding heat styling. And please wash your hair at least twice a week. A lot of people think that if you wash your hair too frequently, the baby might catch cold. That is totally false. You have to wash your hair at least twice a week to keep the scalp clean. So what are the medical treatments that we usually do for this postpartum hair loss? Number one is supplement. We all know this postpartum hair loss is because of sudden shift in your hormones, and also of course increased requirement of nutritional needs. You have to continue your iron supplements more than 3 months or as per your doctor's advice. You can also consider taking other multivitamins based on your need, and you have to visit a qualified doctor if you think your hair loss, like I said, is more than 200 strands per day. Some of the things that doctors might check for if you visit them is nutritional deficiencies, the most common being iron, vitamin D and B12. They might also look into your thyroid levels because postpartum thyroid hormones can go here and there. And if there are any changes, putting on these supplements or adding on your thyroid supplement will help take care of this hair fall. Another important thing we usually follow is usage of Ravali or Procapil based peptide based serums. This help in controlling your hair fall. Post your breastfeeding, if your hair fall is continuing beyond a certain time, the doctors might even consider Minoxidil or some in-clinic procedures like PRP therapy or growth factor therapy. But this totally depends on what is the cause of your hair fall. Just for your simple postpartum or post-pregnancy hair loss, we usually don't need these additional supplementations. But if there are other reasons for your hair fall, the doctor might suggest these. And please understand that postpartum hair loss is temporary. Most of the times this hair will completely grow back, and well-balanced meals, a good sleep and supplementations are necessary. I hope this video has helped you understand why we lose hair post-pregnancy and how common it is. And if you have new mothers with you, please share this video with them. Please subscribe to my channel to see more such videos.